It's now time for the Advanced Medical Solutions Show, helping to improve your life each and every day. And now your host, Fulton Wooten and Dr. Dwyer Scott.
Good morning, Myrtle Beach. Good morning, USA. This is Fulton Wooten. I am live this morning with Dr. Dwyer Scott of Advanced Medical Solutions. Dr. Scott, how are you doing?
I'm doing pretty great, Fulton. Good to see you, my man.
Awesome. Glad to see you as well. We've got a lot of exciting news. We have a special guest with us here today. You and I have discussed it for just a few minutes before we got here, but now I'd like to introduce Dr. Blount.
Dr. Blount, Stephen Blount. Tell everybody who you are and where you're from.
Well, obviously I'm here now. So where I've been, it's been a long road. So conceived and raised in the Bronx. How's that sound?
Okay.
But then married a Texan and picked up a little bit of the language. You know what I'm saying?
Excellent.
Okay.
A little bit of that southern slang?
Yeah, a little bit. And been around quite a bit in practice for 30 years, but retired recently. Came here to get away from the North.
Okay.
For a lot of reasons. The white stuff is one of them.
Okay.
But governance was another. But my wife is challenged and some health problems, and this climate's a lot better for her. And kind of like the people down here, actually.
How long you been here?
3 months now.
Oh, wow.
Yeah.
Wow.
Feels
Welcome
like
to
a lifetime.
paradise.
Absolutely.
Yeah, people have been nice. That's the greatest resource down here as far as I've found so far, the people.
Oh, the people. You like the people.
Yeah, and the women call me honey. Honey. And, and all people, all the colors, they're treating me I can just talk to them the way I feel like talking to them.
Yes.
I was at a Waffle House the other day, if I can just tell you, and this black lady had a lot of these little rolls and stuff. And looked, like I said, how long does it take you to do that? She says, I got a secret for her, and she took her wig off. So it made me laugh. So you can have regular interaction with people, not have to feel so inhibited, like, oh, did I say something? No, just speak your heart, be kind, and be respectful, and have a good time. That's what life's supposed to be about.
That is what life's supposed to be about.
I found out here it's a lot easier than most places I've lived. Good.
I've got this question. Did you try the grits?
Oh, yeah. I don't like it with the cheese, though. I like it without the cheese. When you go to Waffle House, though, you got, that's a problem for me. I got to stay away from there. I like it too much. So, yeah.
Shout out to Waffle House.
Shout out to Waffle House.
Yeah.
Scatter, smother, covered on those hash browns.
Triple dose.
That's right.
Triple dose. Triple.
So many different ways. So,
yeah.
Well, we're glad to have you this morning, Dr. Scott. You and I, man, I tell you what, it's been busy. We've had a lot of conversation going on, and there's so much happening right now. There's so much going on around the office. I walked in the office Tuesday morning. The training was just finishing up, and there was more excitement in there. There are new faces. Dr. Scott, the businesses is just, people love what you're doing at Advanced Medical Solution. You're having to hire new people all the time. I see new faces every day.
Well, it's just getting so busy. There's so many people getting relief, and at the same time, there's so many people hurting. And the team that we have there.
Yes.
It's phenomenal.
Yes, they are.
I mean, it's just phenomenal how they're able to make it very efficient and effortless for people to get out of pain. The doctor came in. I think we had dinner one night.
Yeah, I went to one of your dinners, and my wife was with me, of course. And I looked up there and I saw him talking, and I knew it was a chiropractor right away.
Okay.
Because he had a freedom of his speech. He wasn't so confined. And I used to do talks myself years ago, and it's difficult getting up there. And but when you're speaking the truth, it's a lot easier.
It's a lot easier.
You don't have to backtrack. You don't have to think about it. And I asked some questions, and so did my wife, because we wanted to check him out, and he had answers. You don't get up there unless you have answers. So we decided, based upon what he was showing me, and I had done some research before because I had some personal problems I needed taken care of, and the organization that I assumed was going to help me, the VA, turned out to be less than helpful and more money-driven and politically driven.
Mm-hmm. So with that, you said something that triggers a thought in my mind, because this is something Dr. Scott and I talk about among ourselves and with the patients. What made you look into this type of treatment with Dr. Scott?
Well, years ago, I was a designated doctor for the Texas Workers' Comp Commission, and I had to do functional evaluations on people. And after a while, you get enough patients come through, and then you see them through the years, and they get knee surgery and such, and they have to go back again, or they're miserable. And Their lifestyle doesn't change. They don't learn. They're not educated enough. They're not taught how to do things different. You just can't put a knee in there and expect to gain 400 pounds and feel good. So, or light a cigarette. It's just ridiculous. So, when I came into this area, I already had done some research about it, and I saw that the veterans in the field, the military in the field, were getting stem cells for head injuries and such. And I go, oh, well, they got it going. Well, I wanted to find out what happened when I became an honorable discharge veteran. I no longer qualified for that. What happened? And that's my rest of my retirement is going to be devoted to get the veterans to get what they deserve, what works. But the problem is there's no profit for the AMA. When you're not a patient anymore with the knee, guess what? You can't prescribe to them. You can't do any of this other garbage and have them back in again. I'm a doctor, and I'm telling you, I've been through it, and I can tell you the whole thing. If you'd like to know what happened with me, I'll tell you. I don't know how much time you have. I'll tell you.
We never have enough time.
We never have enough
you know
time.
what? We talk about the system. We talk about the swamp. Dr. Scott, I mean, he fights through it every day. He's the one person out there who's taken the responsibility to really go after this, and now getting you on board, your support in what Dr. Scott at Advanced Medical Solutions trying to do. This is just a win-win-win, Dr. Scott.
So I know you had, I think you had at least one, if not both knees in pain, degenerated. Tell us a little bit about that, what you were suffering with. And
my right knee was diagnosed with osteoarthritis, and my left knee also, but not to the same extent. I have a torn meniscus on the right also, and pretty much bone on bone on the right mostly. The left one, I had polio from the vaccine when I was a kid, to let you know.
Okay.
And I won't go there. But it has been challenged because it was biomechanically different and was changed. I had to do a transplant of a muscle. So it always has been a little bit of a trouble. After the treatment, the left leg has completely healed. The left knee doesn't bother me, no noise. I got most of my range of motion back. I say all of it, no pain.
Mm-hmm. So you were noticing pain and noise, and
oh yeah,
what were you noticing before in that left knee?
Well, pain, noise, crepitus. You can feel a pop once in a while. The patella wasn't having a good time tracking. That's no longer a concern at all. The right knee, that's a different story. So I've been under the care of Dr. Scott and his wonderful team for 2 months now.
Okay,
and I will tell you, conservatively, yes, I've got at least 50% better range of motion, and it shows in my tests, and a 50% reduction in pain. So I can stride when I walk now. I don't wobble. I never got to the wobbling. I don't want to. So, but Dr. Harrison, when chiropractor working with Dr. Scott, was initially helpful in talking to me about getting my core back. And a lot of people don't talk about that. And I tell you, I've been working it.
He spoke your language, didn't he?
He did. It's no BS with him. It was straight. When you go to your doctor, there should be no lying, no bullshit, BS. Just be straight and tell them how it is. But here's the big question that every doctor gets, and we all hate this question. Well, the ones who are not integrity hate it. When they ask you, well, doctor, should I undergo this surgery or should I do this? And you say, well, that's your decision. Then they say to you, well, what would you do if it was you? Now you have to be honest. And you have to tell them. And you may not get that from all different types of practitioners. But I have to say, yeah, I'll do this for myself. And I won't go off into the vaccines and stuff, but they can ask you lots of questions. But when you put it back to you, what would you do for your family? If you're honest and you say, hell no, I'm not going to give this to them, well, then why would the patient want the same thing? So
exactly.
It's honest, be honest, straight honest, be kind, deliver kindness, but with facts, research, and with heart.
Thank you, Rick. And this is Fulton Wooten. I am here this morning with Dr. Scott, and we have a special guest with us, Dr. Blount. He is a patient at Advanced Medical Solutions. He's been there about 2 months. He's explaining his experience with me and Dr. Scott this morning. And Dr. Scott, you and I both know he is right in the prime of what he's doing. Those cells are taking place, and he's starting to feel the good, and it's the snowball effect that we talk about.
That's right. We treated both knees. Left knee's doing perfect. Right knee's, within 2 months, 50% pain's going away, 50% functions better. Right. And based on what you're seeing right now and how you've responded so far, what do you imagine happening in the next month or two?
Well, I noticed because of the change in symptomatology, and I'm having a lot more noise in the joint, which means the scar tissue is leaving, and now we're building up new tissue. I expect full recovery within a couple of months.
Yeah, that's awesome. The 3 things that we talk about are the first thing that happens is decreasing inflammation, which is the pain, and you're noticing that right away. And the second thing that happens is tearing up scar tissue, which causes the increased range of motion. It also causes some noise, some grinding. It's just like, it's breaking things up. And then lastly, what will happen, that tissue will start regenerating into new tissue, and it'll be harder to injure. And if you do injure it again, it heals fast, very fast. So that's what you're looking forward to.
Yes, and a lot of patients are impatient a lot of times, and I tell them, look, you're going to retrace a little bit. It didn't take you a day to get here. It's not going to take you a day to get back, so be reasonable and do your exercises and follow on the protocol. The protocol is proven, so go with it.
Yes. Oh, no doubt. And not only is the protocol so effective, but I'm going to give you a chance to answer this question about Dr. Scott and Advanced Medical Solutions, because I already know the answer. Many times when people seek to see a doctor with this type of practice, which is not your normal MD, it's that they don't know what to expect. So tell the people out there in radio land just how easy it is to become a patient at Advanced Medical Solutions.
Well, they will do a full intake on you. Mm-hmm. So they need to know everything about you. And if you get less than that, then walk out the door. Okay. So they ask me all the right questions, and I tell you, I'm very critical of that. My wife has been a nurse for 30 years. Both of us were watching these forms we had to fill out, and the person that took the intake and knew what kind of questions they were asking. Then I started asking questions, and they showed me my x-rays. Took x-ray, great x-rays. Okay? Yes. First of all, you can actually see them, all right? And they went through them with, they honored the patient. You show them. People can understand. You show them. Mm-hmm. And then they come up with a program for me to follow. Everything was reasonable and was scientifically, to me, was proven, because I did my research before I came there. So I understand they were on key. And some of the main questions that everybody's worried about, are you using fetal tissue and all that stuff? No. Read the brochure, read and ask the doctor where all this stuff comes from. And it comes from an umbilical cord after a baby is born. So it's going to be thrown in the trash. Hey, can I have that so I can take some stem cells and help somebody? Okay. So I got those stem cells.
So yeah, as we go to Advanced Medical Solution, when I'm a patient, just like Dr. Scott, and I've seen the effort he's put in to this system and the path for the patients, the convenience, not only in providing the best high quality products in this market out there. He and I have continued to do the research. Dr. Scott continues to refine his program, looking for perfection. That's just his personality. That's just how he runs his business. Thank you, Dr. Scott, for taking that responsibility for the patients, Dr. Blount, and everybody else here in the Myrtle Beach area.
You're welcome. It's a responsibility, but the great part is the results that everybody's getting. I mean, you've been in that office.
What you hardly fit in the office today.
What do you see other people doing in there? I mean, compared to a normal doctor's office, like Fulton said, it's not a normal. Anybody who hadn't been there kind of describe the difference between advanced medical compared to a typical medical's office.
Well, you look at the patients. I talk to everybody who comes in there because I'm curious about their experience. Or if they first got there, they're a little bit afraid and such, and then I tell them about me. Most of the people are happy. They're smiling. Everybody has a little bit of pain when they're going through stuff, but they're not miserable. They're looking forward to the visit, not like, oh my, what are they going to shoot at me with now today? They come out feeling better, and they know they've got something for their value. Somebody actually touched them at a core. Mm-hmm. That is important.
You heard any cool stories there? You talked to anybody specific?
Yeah, yesterday I had a husband and his wife come in, and for the first time, and they were sitting there in their massage chairs waiting to get their exam and everything. And I was asking her, she had several surgeries on her right shoulder. She had foot surgery. She had neck surgery. Mm. My, I wish you had come here before all of that. She's expecting miracles. And the first thing she said to me, well, how soon after I get the shots can I go out and play tennis? I go, now, you're going to have to do the whole program, right? That you don't stop. You don't stop midway when you're going somewhere, expect the results to happen. It says, please pay attention. I'm a doctor. I'm paying attention. Pay attention. It's worked out. It's scientifically proven. Be your best friend. Don't fight the doc, but ask a hell of a lot of questions, and you'll get your answers. Stay on key.
Yeah, oftentimes we tell people, because people, especially when they start getting treated, they start feeling better so fast, and they're wondering, because really, nobody really wants the treatment. Nobody really wants this. What they want is they want their life back. They want to be able to go back and play tennis. They want to be able to walk on the beach. They want to be able to walk around the neighborhood with their spouse and go shopping. and just be able to, at least just wake up or go to bed without being in so much pain. That's what they really want. They want their life back. And we always tell people, based on the research and what we've seen over the years, even decades of the best protocols and practices, we always recommend people, don't do anything for the first 2 to 3 weeks, 2 to 4 weeks. Don't do anything that you normally wouldn't do with the pain. But after that, then we really start driving some activity, because that activity actually activates and allows these treatments to work stronger and better. But it's really hard when somebody, after a week, they've been in pain for 1 year to 10 years, and then within a week, they're feeling better, and they're getting out of pain like they haven't experienced in even potentially a decade. And it's hard to pull those reins back and say, no, don't go golfing this weekend. My family's in town. All right, go. Just be smart. Yeah. Be careful.
How you feel? Great. I played 36 holes of golf yesterday.
I know.
Happens all the time.
How many times do we have that conversation?
All the time.
It's such a win-win when those cells go in the body and they start to take effect, and then the body starts to respond. You and I talk about the mental clarity that comes with this procedure of eliminating that pain. When you start to eliminate that pain, we talk about givers and takers, and everybody has a desire to give in some point. But when you become so inflamed and in so much pain, you can't do nothing but worry about yourself, and you leave others out. You and I talk about that all the time. Actually, it's your topic. I'm just repeating what you've said there. So the ability to reduce that pain level, open up those receptors, so we're sending positive energy, from the brain to the body and the body to the brain. I mean, it is life-changing, and that is what you're talking about, seeing in there with the patients at Advanced Medical Solution. And because of the path and program Dr. Scott has put in place, I'm not going to say his employees have an easy job, because they don't. Working for Dr. Scott is taxing. It takes effort, because he expects nothing but the best out of his employees, because they're giving it to his patients.
That's right. Well, we got lives on the line.
Absolutely.
We take it serious. Now, we have a great time. It's a great place to be.
It's a crazy
We
place.
have a lot of fun.
It's a lot of fun, but
we're serious.
That's right. It's very serious. That's right. And what was I going to say? We were talking about, this is one of the things that's completely different at Advanced Medical than most places. And we tell our patients this all the time, that we're here to take care of you. They say, well, when can I do this? Can I do this? Can I do that? Can I work out? Can I do this or that? The goal for us is to take care of you so you can do those things and more, not to stop. So it's very difficult, and actually, outside of our protocols, to tell people to not do anything unless we feel it's going to cause some injury. But we really, the goal is to take care of you so you can do things and more, not stop. So it's very rarely do we tell somebody to, don't do this. You can't, you'll never play golf again, or you don't need to do this again ever. Nah, that's not the goal. The exact opposite.
Exactly. Now, Dr. Blount, with the people out there in Radio Land, if there's anybody who has a question about why they should not do this, what would you tell them? What would you tell them why they should? What do you see for them, for somebody who can't quite make that decision?
Well, a lot of times, because insurance doesn't cover this yet, the finances may be a problem. I look at them, I say, let me ask you a question. Would you like a knee replacement that doesn't cost you anything, but pain and discomfort and lack of activity and all kinds of problems with it, taking drugs to support pain, or would you like an alternative that's a hell of a lot less expensive and last a lifetime? What would you like? What's the reasonable? How reasonable are you about your future? Do you put it in other people's hands, or would you take back your life? You're on the team when you go to Dr. Scott's place. What you do is part of the team. Reasonable expectations with a reasonable time and reasonable exercise, When I got my shots, I know not to go out and lift a 50-pound box for a while. Give myself a break and be reasonable about it. After a while, you can start increasing your activities and such. Reasonable, but explain to the patient what's going on. They'll get the answers, but they don't have to be medical slaves anymore.
All right. Thank you, Rick. Welcome back, everybody. I'm here this morning with Dr. Dwyer Scott of Advanced Medical Solutions.
Good morning.
All right, everybody out there. And we're sitting here with a colleague of Dr. Scott's, Dr. Blount, who is also a patient at Advanced Medical Solutions. We're talking about his experience there. And I'm going to tell you something, Doc. My favorite thing about Dr. Scott's practice, Advanced Medical Solutions, is there are no prescriptions written to the patients. You never walk out with a prescription for pain medication. That's my favorite thing, Dr. Scott, and I commend you for that. I'm proud of you for that. I wish everybody else had the passion and feeling I had towards you about that. That is very commendable.
Well, thank you. We know pain medications and the opioid epidemic is a huge problem. So not only are we trying to get people out of pain and help them feel better, also indirectly, there's a huge initiative to help people avoid those pain medications and these addictions. Because once you start going down that road, it's almost impossible to come out of. I mean, it's very difficult. And so the best way to help people is to keep them from going down that road and getting stuck deep in there.
Agreed.
So that's really where we're at. And the things that we've done over the past 4 years, I can't imagine the amount of opioid use and pain medication that we've helped people avoid, and which would affect hundreds, if not thousands of lives directly and indirectly.
Amen.
And there's a huge problem with that with our warriors. You and I have talked about it. Our veterans, the doctor is also a vet, and he has a huge passion. And we're taking this initiative. I know we've been talking about it. We've been working with some groups, and we're taking an initiative, and we've actually gotten a regenerative medicine product available for those veterans who have TRICARE.
Yes.
It's a first step in that direction. And I know the doctor, he's very passionate about helping us with that initiative of getting to these veterans what they deserve and what they need.
Oh, yeah. Well, some of the veterans, we call it the China syndrome, because all they want to give us is drugs made in China. Muscle relaxers, painkillers. That's what you get.
Mm-hmm.
Or steroid shots. How about that?
Mm-hmm.
Maybe a hyaluronic acid shot. What other shot do you want to give me today?
Cortisone.
How about something to actually help me regenerate? You're doing this for other people, but why am I not qualified to get that? Did I lose my qualifications when I became a veteran and not active military anymore? It's always about the money, people. It's about the money. We got to take care of our people, regardless of that.
I agree.
We all agree with that. You know, there's no doubt the people who put their life on the line for not only for our country, but for our cities, our states, you know, our lives, our children, our families, our mothers. You know, that's a very important thing to do is not only to protect ourselves, but protect those we love and those within this country. You know, we are family. We are family. The feeling of family at Dr. Scott's office at Advanced Medical Solution, you know, where you talk about the team being phenomenal. The reason the team is phenomenal is because that team is tight. They work like a well-tuned engine. There is not one spark plug in that engine that's missing, bro.
That's right. Those guys are sharp.
It is firing on 110%. And I'm glad you get to see that at the office, experience that. I can see the smile on your face now.
I have to tell you, I give them hell when I get in there.
You know what?
And then I found out one of the girls' last name is Hell. Oh, I just couldn't believe it. So I just love her to death. They're all wonderful people and really dedicated to keeping people up on what's going on and keeping him a happy man. They care. He doesn't have to micromanage that place.
Oh, that's right. Yeah, we got the best people.
That's not his style.
No.
But they care. They care. They have empathy for the patient. They understand what the patient's going through, and they're willing to do their part. I said this earlier in this show. Working for Dr. Scott is not easy, and it's not because it's a difficult job. It's because he expects the most for his patients. And that's what those patients are going to get. No question about it.
Yes.
Yeah, we have high standards, and it's a rule in our office that to meet those standards, and we're always driving those standards higher. Set a new standard, set a new standard, set a new standard. We abide by that because medicine is always innovating. We're in the most innovative field of medicine. At the same time, setting a new standard for ourselves, at the same time setting that standard for our patients and our community, that's what's got to happen. That's what has to happen in order to save those people and help those people who don't know any better. It has to happen that way. And the great part is it is happening that way.
It is.
And it's amazing to see.
It is amazing. And if you're one of those people out there who can hear my voice right now, anywhere within this range, there's not another Dr. Scott. Okay? There's not another advanced medical solution. So this is the place that you have heard about, that you hear about us talk every week on the radio with patient after patient after patient coming in here and giving their testimony like you've just heard. We've talked about it wrapping around the building if we brought everybody in at once, and that's just a portion of the patients. That's enough.
Right. So we got about a minute left, Doc. If there was one thing that you could leave with the hundreds and thousands of people listening right now, if there's one thing you could leave with them, what would you say to them?
I could say it's a total program. They have chiropractic because maintaining structural integrity while you're healing is important. You can't just go to get a shot and leave. You have to be lined up, everything working properly so it can heal. Get the whole program and stick with it.
I'll agree.
Well, hey, it's been a great time. Fulton.
Dr. Scott.
It's been great seeing you.
Awesome. Always.
Awesome. Rick Roberts.
Thank you.
Yes, sir. Jensen, Dr. Blanc, it's nice to be here. I'm glad you're here. Hey, everybody, we're going to wrap this up. We're going to see you next week. Stay healthy, stay smart. Bye, everybody.
Thank you, Dr. Scott. Thank you, Fulton. Thank you, Dr. Blount, for being a guest today. Are you looking to get out of pain? Are you looking for fast, effective pain relief? Well, it's simple. It's easy. All you have to do is call Advanced Medical Solutions right now. Don't wait till tomorrow. Don't wait till this afternoon. They've got somebody standing by the phones right now. Linda is standing by the phones looking to take your call. 843-997-2344. That's 843-997-2344. If you're looking to get out of